So, hello there. I'm going to be talking about coronavirus symptoms this time, and the new symptoms that have been added to temperature and cough are a lack of sense of smell and a lack of sense of taste. And they've been added because they're very specific to coronavirus, and a lot of people are finding they're sometimes the only symptoms they get. And it's been kind of now identified that this is something which we don't know why, but the virus, when it gets into the nose, seems to target the olfactory nerve, which is does the sense of smell. In fact, it does both. That's why you get both together. Um, and that olfactory nerve is sitting behind the nose, and it's nothing to do with congestion of the nose, like you get in hay fever or cold when you can't smell anything or taste anything, because that is just congestion and the nose isn't working so well. So if you get congestion, that isn't coronavirus. This is when you've got a very clear nose, you might be feeling unwell, but you can't taste or taste of cardboard and you can't smell anything. So what are the symptoms? Well, as the virus travels down into the lungs, it goes past the throat, so you get a sore throat very often. It then gets into the lungs and you get a cough and you get a temperature because the body's trying to fight the infection. Now, what else seems to happen is that as the virus starts to cause this inflammatory response across the body, you start to get little clotting defects and you start to get things called chilblains on the end of the toes. It's called COVID toe. And that's little red areas, even dark mauvish areas, which are caused by the lack of circulation in those toes. And it can be quite painful, mostly in children, interestingly, but anyone can get those. Other rashes on the skin can be like hives or chickenpox viruses, chickenpox rash, and that seems to be a bit unusual, but certainly there seems to be a lot of rashes associated with COVID. Even vomiting and diarrhea on its own can be from coronavirus as well. And some people are saying, "Oh, I'm dreaming, really weirdly during this lockdown. Is that coronavirus or not?" Well, probably not. It's probably just the fact that you're sleeping better. And if you have a longer period of sleep, you get more REM sleep. And if you get more REM sleep, you're going to actually dream more because that's when you get the dreams as you're about to wake up. So, not having to get up so early to get the children to school or go off to commute is probably the reason why you're getting more dreams. As the virus progresses, it starts to get into the lungs a bit further, and that's when you start to get the shortness of breath. And then, of course, it can affect the heart and the kidneys as well. But the most important thing is to remember is this lack of sense of smell and taste, which are very specific to coronavirus. It does come back if you get it, so don't worry, things won't taste of cardboard forevermore, and hopefully you will get a lot better. Thank you.